Let me ask you something. When you wake up in the morning, is the first thing you reach for a glass of water? Not because you're thirsty exactly, but because your mouth is so dry, so sticky, so uncomfortable that you basically can't function until you've rinsed it out. Maybe your lips are stuck together a little. Maybe your tongue feels like it's coated in something. Maybe your throat feels tight and scratchy before you've even said good morning to anyone. And here's the thing, you've probably just accepted that. You've filed it under getting older and moved on with your day. Most people do. I'm Dr. Raymond Cole. I've been a senior health physician for years, and I need to tell you, that morning feeling that you've normalized, that you've never once mentioned to your doctor because it seems too minor to bring up, is connected to some of the most serious health complications I see in adults over 60. Pneumonia, heart disease, accelerated cognitive decline. I know that sounds like a stretch. Stay with me, because by the time I walk you through what's actually happening inside your body while you sleep, you will understand exactly why that connection is real. And number 4 on today's list, it involves something that 73% of adults over 65 are doing every single night that is making every single one of these dangers significantly worse, and the people writing their prescriptions have known about it for decades. Here is what I need you to understand first. Chronic morning dry mouth, the medical term is xerostomia, affects between 30 and 40% of adults over 65. That is not a rare condition, that is an epidemic. And the average doctor's appointment is 11 minutes long. In those 11 minutes, dry mouth does not make the list, so the symptom gets dismissed as aging. The causes go unchecked, and the consequences keep building quietly in the background. Over 500 commonly prescribed medications list dry mouth as a documented side effect. 500! The pharmaceutical companies know this, the prescribing doctors know this, and the overwhelming majority of patients are never told, never warned, never given the information to connect what they're waking up feeling to what it is doing inside their body. Before we go further, scroll down and type your age in the comments, just your age. And if you wake up with a dry mouth regularly, add the word yes. We read every comment on this channel, and your response shapes what I cover next. Today, I'm going to give you 7 dangers, ranked from serious to absolutely critical, with the exact research behind each one, and something actionable at the end of each section. One thing before we start. Danger number 2 is the one that surprises people most in my practice. It has nothing to do with your mouth and everything to do with where that bacteria travels while you sleep. Let's go. Number 7, and this is the foundation. Everything else on this list builds on top of it. Most people think saliva is just spit, something your mouth makes so food goes down easier. That is not even close to what it actually is. Saliva contains over 700 proteins, enzymes, and antimicrobial compounds working continuously around the clock to identify and neutralize bacteria, viruses, and fungi before they get a foothold in your body. Every time you swallow, you do it somewhere between 600 and 1,000 times a day. You are sweeping a wave of biological defense through your mouth and sending those pathogens into your stomach where they get destroyed. That is your oral immune system. And when you have chronic dry mouth, that system is running at a fraction of its capacity. A 2022 analysis in the Journal of Clinical Periodontology found that adults with confirmed xerostomia had 3.4 times higher concentrations of pathogenic bacteria in their mouths than those without. That sticky film you wake up with every morning, that is what 3.4 times the normal bacterial load feels like after 8 hours of sleeping without any defense. What to do right now? Use a xylitol-based rinse at bedtime, not alcohol-based mouthwash, which makes things worse, and a tongue scraper every morning before you eat or drink anything. This removes the overnight buildup before it can travel. Number 6. This one surprises almost everyone I tell it because it has nothing to do with your mouth. Saliva is the ignition switch for your entire
digestive system. It contains enzymes that begin breaking down food the moment it enters your mouth. It signals your stomach to prepare for digestion. When salivary output is compromised, that process is disrupted from the very first bite. Food arrives in your stomach less prepared than it should be. For adults over 65, where stomach acid production is already naturally declined, where B12, magnesium, and zinc absorption are already less efficient, that disruption at step 1 cascades through everything that follows. A 2021 Mayo Clinic study examined over 4,400 seniors diagnosed with unexplained malnutrition. 44% had clinically significant xerostomia that had never been identified as a factor. Nearly half of people being treated for malnutrition were malnourished in part because their mouths could not prepare their food properly. Not one of them had been told. The consequence is slow and invisible. Muscle mass drops, fall risk increases, immune function weakens, energy falls, all connected to a chain that begins with that morning glass of water. What to do? Ask your physician specifically about B12 levels at your next visit. Eat slowly and deliberately, and chew more than you think you need to. It is one of the few free tools you have to compensate for reduced salivary output. Number 5. This is where we stop talking about your mouth and start talking about your heart. Saliva. When saliva is chronically low, pathogenic bacteria overpopulate the gum line. They trigger inflammation, redness, swelling, bleeding when you brush. Most people see that bleeding and think they brushed too hard. Here's what's actually happening. Inflamed gum tissue is not a sealed barrier. Every time those gums bleed, microscopic doorways open between your oral cavity and your bloodstream, and bacteria walk right through. A 2023 paper in Nature Reviews Microbiology identified that specific oral pathogens, once they enter the bloodstream through compromised gum margins, have been found directly embedded in arterial plaques in the coronary arteries, in the arteries that feed your heart. A 2022 study in the Journal of the American Heart Association followed 8,300 seniors over 65 for 6 years. Those with significant untreated gum disease had a 49% higher rate of heart attack and stroke, 49% from bacteria that originated in a dry mouth. What to do? Floss every single night, not for your teeth, for your heart. You now know why. And at your next dental appointment, say, "I'm concerned about my salivary levels, and I want a periodontal assessment." Those words will open a door that a vague complaint about dry mouth never would. Don't wait for your next scheduled appointment. Call this week. Everything I share is for educational purposes only and is not medical advice. Always consult your physician before changing or stopping any medication. Number 3. This is the danger that ends lives quietly in the middle of the night, and it's consistently underestimated even within medicine. Every night while you sleep, microscopic droplets of saliva are silently being inhaled into your lungs. Doctors call it microaspiration. It happens to everyone, but in a healthy mouth, the bacterial load in those droplets is low, and the body handles it. In a dry mouth, that bacterial load is 3.4 times higher. Those organisms, once they reach the warm, oxygen-rich environment of your lung tissue, can cause a rapidly progressing infection. You don't have to choke, you don't have to cough, you don't feel anything at all. It happens while you sleep peacefully, completely unaware. A 2021 UCSF study followed 12,000 seniors for 36 months. Participants with confirmed xerostomia were 2.8 times more likely to be hospitalized for respiratory infection, nearly 3 times the risk, hiding in a morning symptom most people dismiss before their first cup of coffee. Aspiration pneumonia is one of the leading causes of hospitalization and death in adults over 65. Not a remote possibility, a leading cause, and a dry mouth is sitting at the beginning of that chain. What to do tonight? Elevate the head of your bed 4 to 6 inches using bed risers, not extra pillows. Run a cool mist humidifier at 40 to 60% humidity. Use a xylitol-based rinse immediately before sleep. If you snore heavily or wake up unrefreshed regardless of how long you slept, speak to your doctor about a sleep study. Do not wait. Number 2. This is the one that stops people cold in my practice, because dry mouth is not always a side effect of something else. Sometimes it's the primary symptom, the messenger, your body flagging something deeper that hasn't been diagnosed yet. Here are the 5 conditions it may be pointing to. First, uncontrolled diabetes. High blood glucose reduces the microvascular blood supply to your salivary glands. If you wake up with a dry mouth and also wake up frequently at night to urinate, that combination is a documented diabetes warning. Request a fasting glucose and HbA1c test. Second, Sjogren's syndrome, an autoimmune condition where your immune system attacks your own moisture-producing glands. The average time between symptom onset and correct diagnosis is 6 to 10 years. If your dryness doesn't respond to water or humidity, and you also have chronically dry eyes, ask your doctor for ANA, anti-SSA, and anti-SSB antibody screening. Use those exact words. Third, early kidney dysfunction. If your morning dry mouth comes with a breath that smells metallic or chemical, not just stale, that's a potential kidney function warning. Request a comprehensive metabolic panel with creatinine and BUN levels. Fourth, early neurological conditions, including Parkinson's.
Saliva production is controlled by the autonomic nervous system. Disruption in those pathways, which can begin years before more obvious symptoms appear, often shows up in salivary output first. Fifth, undiagnosed sleep apnea. Dry mouth that is worst on waking and improves through the day is a textbook sleep apnea pattern. The airway collapses during sleep, the body compensates by opening the mouth, and 8 hours of airflow desiccates every wet surface. If this is your pattern, speak with your doctor about a sleep study. Do not wait. For any of these, do not accept "it's just aging" as a diagnosis. That is a dismissal, not an explanation. You have every right to push past it, and now you have the vocabulary to do exactly that. And number 1, the most dangerous thing about morning dry mouth is not any single item on this list. It is all of them happening simultaneously, compounding silently, connecting to each other in ways that no single specialist sees, because no single specialist is looking at the whole picture. Let me tell you about a man named Frank, 71 years old, retired electrician from Dayton, Ohio, 39 years in the trades, the kind of man who handled everything himself and asked for help from nobody. Frank woke up with a dry mouth every morning for 3 years and said nothing about it, to his wife, to his doctor, to anyone. It was nothing, just getting older. Over those 3 years, Frank lost 8 teeth. His cardiologist found arterial inflammation that had not been there before. He developed 2 chest infections in 14 months. His wife noticed he was quieter, less sharp, more withdrawn. He stopped going to their Tuesday card game because he was always tired. When Frank finally came to see me, we found 6 medications, 4 with documented xerogenic effects, mild undiagnosed sleep apnea, and a resting salivary flow rate at less than 20% of what it should be. None of it happened in isolation. The dry mouth created the bacterial overgrowth. The bacteria damaged the gums. The damaged gums opened the bloodstream. The oral bacteria drove the arterial inflammation. The aspiration events caused the chest infections. The compromised digestion contributed to his fatigue and cognitive fog. Every single link in that chain started with a symptom he dismissed every morning before he got out of bed. We adjusted his medications, treated the sleep apnea, built a 4-minute morning oral care protocol. Within 3 months, his decay rate had slowed dramatically. His cardiac
inflammation markers improved. Frank called my office on a Tuesday and said he had made it back to card night. That is not a minor thing. That is a life. Here's what I want you to do starting today, not next week, today. 1. Every morning before you drink anything, take 30 seconds. Note whether saliva is present, whether it's thick or thin, whether your breath smells chemical or metallic. Write it down for 2 weeks. You will have data your doctor will actually respond to. 2. Write down every medication you take and call your doctor this week. Say, I would like a polypharmacy review examining my combined xerogenic and anticholinergic burden. Write that down right now. 3. Stop relying on thirst to tell you to drink water. After 65, that signal is genuinely unreliable. Small, consistent sips throughout the day, not a large glass at bedtime, which disrupts sleep without helping your glands. 4. Tonight, bed risers for 4 to 6 inches of elevation, cool mist humidifier at 40 to 60% humidity, xylitol-based rinse before sleep, not optional if this is a nightly problem. 5. Floss every night, not for your teeth, for your heart. You now know why. And the red flags that mean right now, no waiting, no monitoring. White patches in your mouth, dry mouth with difficulty swallowing or breathing, chest pain with dry mouth, sudden confusion alongside dry mouth. Those are same-day calls. Some are 911 calls. Do not wait on those. I want to say one thing before you go. You are not broken. The information you were given was broken. Your body has been telling you something every single morning, every time you reached for that glass of water. It was not being dramatic. It was doing exactly what bodies are designed to do. It was asking for attention. Now you can give it that. Frank is back at card night. Gloria's teeth have been stable over a year, and you, right now, know more about the real consequences of xerostomia than the majority of adults your age. Use that. In the comments, type Frank if you've been dismissing your dry mouth and you're taking this seriously starting today. Type medication if you're on 3 or more medications and you'll request that review this week. Type protocol if you're starting the bedtime steps tonight. Then share this with one person over 60 in your life, because there is someone who is waking up every morning with this exact feeling, dismissing it the same way you used to, and heading for the same chain of consequences Frank almost didn't come back from. You may be handing them the thing that changes everything. Subscribe and hit the bell. Next video, I'm going to reveal the 3 foods most seniors eat for breakfast every morning, believing they are protecting their heart. Number 2 has been recommended by doctors for 30 years. The latest research says it may be doing the exact opposite. You're going to want to see that. I'm Dr. Raymond Cole. Take care of yourself. You deserve it.